McMaster University hosted the 14th Annual Bethune Roundtable Conference, the premier global surgery conference in Canada. Inspired by the theme, Improving Global Outcomes Through Safer Surgery, there were 150 participants from 17 countries. From over 150 submissions, 48 papers were accepted, including 14 visiting scholars who presented their research. Oh, that actually sounds a bit over the top. Honey, we've been asked to put together a little presentation about the McMaster BRT. Since we're cooped up here together, I just wondered if you'd give me a hand.
Sure, dear. Sounds like you need it. I know you were really excited to attend the early Bethune Roundtable conferences in Toronto. Massey, Andrew, and Anne ran the first ones out of their own back pockets, as Massey said. It was an inspired vision to host an interdisciplinary surgical conference with invited scholars from low-income countries.
Yeah, and I remember the speakers included Adrienne Clarkson, the former Governor General of Canada, who'd written a biography of Norman Bethune.
That's right, I read that book.
Well, considering Bethune was an outcast in his own land, I didn't quite realize he was so famous as an international surgeon. At the BRT several years ago in Toronto, actually, I walked across campus to see Bethune's statue and found it surrounded by a busload of Chinese tourists making a pilgrimage to one of their national heroes. In 2009, we had our first opportunity to host the BRT visiting scholars at a post-convention course in laparoscopic surgery. The participants included a who's who of global surgical leaders, and the FLS course was fantastic, led by our own renowned Dr. Alan Okranik.
Remember when Blair and I drove them to visit Niagara Falls? What a blast that was to see the excitement of our visitors, then welcoming them to a dinner at the McMaster Faculty Club.
Yeah, and then the BRT began to be hosted by other cities, Calgary, Montreal, Vancouver, and we started lobbying to bring the BRT to Hamilton. We put together a fantastic planning committee, including input from our LMIC partners and the full support of our chair, Dr. Susan Reed. Here's a picture of her from then with Uganda's Dr. Olivia Katuka and Dr. Pankaj Jani from COSEXA.
Yes, I remember you were excited, nervous, and eventually totally consumed by the planning and preparations.
Well, thank goodness that Helena Collins agreed to be our conference coordinator. She brought organizational skills, experience, and wonderful enthusiasm.
She remembered recently that we had worked extremely hard to prepare the scholars for their travel to Canada, such as weather and appropriate attire, internet availability, currency exchange, and transportation. She tried to cover everything.
The unique and inspiring feature of the BRT really is the presence of the visiting scholars presenting their own research, and their participation has had profound effects on their careers and their countries. Previous scholars said things like,
"The BRT broadened my horizon to include advocacy, training, research, and health service management." And another said their participation in BRT led to the inclusion of surgical care in my country's national health plan.
wow. So we were incredibly grateful that our own faculty and hospitals, colleagues in Ottawa and Toronto, the Royal College, and of course the CNIS provided sponsorships. We had a budget over $100,000 with some left over to pass on to the next year's hosts. The conference also had an impact on many participants. Dr. Shiloh Rajkumar, recently made a fellow of the Caribbean College of Surgeons, said, "The Bethune Roundtable was the first international conference that I presented at, and was also asked to chair a segment. This did an amazing job for my confidence, and I came back home and coordinated our Guyana Medical Scientific Conference for over 5 years. The best part was sharing my experience to listening ears, and listening to the experience of surgeons from similar resource-poor settings. It made me realize that lack of resources was not unique to my country, and that even with very little, a lot can be achieved."
That's a powerful testimonial. In 2014, 14 of the 15 scholars were able to make it, an incredible organizational feat by Helena.
And by the government visa offices for sure. They included Dr. Abebe Bekele, who's now the founding Dean of Health Sciences at the new University of Global Health Equity in Rwanda.
And Faith Muchemwa from Zimbabwe, founding chair of Women in Surgery Africa.
And our longtime friend, Professor Pankaj Jani from Kenya, former secretary and president of COSEXA. Prof. Jani summed up his McMaster experience. I've been to other BRTs, and this one has to be the best so far. He was being very generous. We didn't have to pay him to say that.
One of the keynote speakers was Dr. Vivian Mitchell, who taught with the pioneering anesthesia training program in Guyana.
So patients with advanced pathology in resource-limited settings need very well-trained staff. And a training program without a sustained, supportive, enabling environment which allows graduates to use their new knowledge and skills will have less health impact. Tekunkura, which is thank you in Amerindian.
One of the things you were most excited about was that the Canadian Journal of Surgery published the abstracts in June. So we were able to distribute the official abstract booklet at the conference.
Yes, there were some great papers. One poster summarized 13 years of BRT presentations, finding that 75% were first-time presenters, 38% were from LMICs, 82% of papers included collaborative authorship, and 17% of abstracts were subsequently published as full manuscripts.
And we had lots of fun. The Saturday evening banquet included Canada's premier blues performer, Harrison Kennedy.
Yeah, he was fantastic. And our after-dinner speaker was political scientist Dr. Catherine Frost, who humorously explored the meaning of the unexamined life. Then there were 3 fantastic Sunday workshops, all fully subscribed. Dr. Karen Bailey paired with Dr. Ron Lett to run a trauma team training instructor course. Dr. Ann Wong organized a regional block course, and researcher Julia Pemberton taught participants about using the REDCap database.
And here's a news update. Recently, Julia has been helping coordinate the response to COVID-19 for Northern Indigenous Health in British Columbia. Of course, one course participant, our friend Dr. Olivia Katuka, said, I have some wonderful memories which have shaped me and helped me become what I am today. Dr. Katuka has recently become president of the Association of Surgeons of Uganda. Now, speaking of women surgeons, is it just me that has noticed that there are a lot of women involved in the BRT? So why does a rascal like Bethune get all the glory?
Good point, dear. There are some awesome female role models in global surgery, especially from Canada. One of the posters highlighted Canadian surgeon Lucille Teasdale's lifetime of service in northern Uganda. Quote, she was a symbol of the potential that a woman has and a promise for a better future for their daughters.
In many ways, she was a better and more long-lasting Canadian role model for global surgeons. She trained her Ugandan colleagues who have made St. Mary's Hospital in Lachor one of the top hospitals in Uganda.
Well, that's true. And Bethune also focused on training Chinese medics. Well, maybe we can propose that on this 20th anniversary, we should change the name of this conference to the Teasdale-Bethune Roundtable, the TBRT.
Do you really think that is likely to happen?
Well, it is 2021 after all.
Well, let's finish with some words by one of our own local heroes, who also helped to deliver our grandson. Dr. Jean Chamberlain has spent decades working to save the mothers in Uganda, one step at a time.
Think about this guy who walked across Niagara Falls, Nick Walanda, and he is such an inspiration to me because I think about here's a guy who takes one step at a time. You can't run across Niagara Falls, okay? This guy was absolutely crazy to do this, but he did it. You know, the birds pecking at his head, the wind blowing at him. Everybody said he couldn't do it, but he said one step at a time. And I think it's the same journey for unsafe motherhood and the care of newborns in the developing world. It's one step at a time, and we need to have determination regardless of the challenges that are around.
So, congratulations to the founders, supporters, hosts, and participants on the BRT's 20th anniversary.